These women were so pleased with the results they saw from using the Kegelmaster that they agreed to sit down and talk frankly about their personal experiences with it.
After the birth of my son, I was feeling very insecure and I was a dancer and I had very strong muscles and I did all my prenatal Kegel exercises, and I was very disappointed at what happened, and I saw the brochure and I was like, I need to get it back.
Good. And Kathy?
Well, as I was getting older, I was in menopause and starting to worry about, how that was going to affect my sex life, and saw the Kegelmaster and wanted to do anything I could to, keep that part of my life satisfying. It's an important part for both me and my husband, and so I thought I would give it a try.
And Tammy?
Well, after my second childbirth, which was 10 years ago, I had a very hard childbirth, and I didn't come back to my normal weight or contract my muscles or anything like that, so the leakage got worse, and I saw the Kegelmaster and I tried it, and it's helped to strengthen my muscles.
Has it improved your confidence in terms of having sex with your husband?
Absolutely, because, getting older and you start to worry about it. You start to worry about whether you're still attractive, whether you're still desirable. And yes, it's increased my confidence a lot. He tells me how different sex is now since before when I wasn't using the Kegelmaster. So yeah, I feel real confident.
It's helped me to reconnect with my muscles, and it's helped with the slight incontinence I had, and with sexual pleasure also.
Oh, my confidence is extremely high, I must say, because if I sneeze and I don't have a leakage, that is like heaven to me.
My feeling from a physician's point of view is I don't want you coming to me telling me fix my stress urinary incontinence. I want you to try something like this before, because more than 90% of the time you will not need to go to surgery if you use a Kegelmaster. That is the way it is. It has been proven in prospective randomized trials that you have to have resistance in the vagina in order for you to understand how good at Kegels are you doing. Are you really doing it, and are you doing it right? So when you put this in, it should feel a little tight, a little resistance against the vaginal walls on purpose. Then you relax against that tension and then squeeze it up. And as you do that, then you are actually realizing that you're closing the device, so you're doing something, as opposed to you may be doing Kegels like you were discussing, just trying to sit in a chair, do it, or I think I can do it, I think I can do it, and not knowing whether you're doing it right. Now when you're sitting here all by yourself, you can do it and get the right muscles to work right. But before that period of time, if you learn it from some instructor somewhere who just says tighten it, most people are just tightening their butt. They're not actually learning how to tighten their vaginal muscles. One of the reasons why you have decreased sexual function sometimes after you have a baby or when you reach the postmenopausal area is because the muscles around the vagina and up around the clitoris and that vasculature is decreased. So one of the ways that you can increase is by using the Kegelmaster. You increase the strength of your muscles, you increase the blood flow to the area, you increase the blood flow to the clitoris, and the clitoris is a spongy material. The reason why it increases in size and responds at all is because it has increased blood flow to it. So the more you increase your blood flow to the muscles in the local area, the more you're going to increase the blood flow to the clitoral area. So that's the reason why your sexual satisfaction and your ability to have an orgasm, the orgasms are better, they last longer, you're a little more sensitive to the whole entire process. And there's been studies done with women who have never ever had an orgasm, that if you teach them how to increase their blood flow to that area, they will learn how to have orgasms. From a physician's point of view, when they first brought me the Kegelmaster, I thought there is no better way to introduce to someone. What I usually do is, at that 6-week visit, I do your pelvic exam and I put my fingers in the vagina and ask you to tighten, and then see how well can you do that. And if you're really kind of on your way to that and you can really get it to squeeze pretty good, then I'm okay with that. Otherwise, I make them start to do Kegel exercises on a regular basis. But now I have a device that I can actually recommend to them that they can use and take home. And you use it for a while, it works great, you forget to use it, you know exactly how to re-strengthen your muscles again and do it in a proper manner. So from a physician's point of view, it's a great thing to have in a doctor's office.
I'd like to congratulate you for taking this step toward helping your body and achieving a renewed sense of confidence and freedom.